Good morning. My name is Priya Hill, and I am a student researcher at the University of Louisville, Department of Surgery. Today, I'll be presenting our work on evaluating the usefulness of fine needle aspiration for small thyroid nodules in patients undergoing thyroid surgery. Fine needle aspiration, or FNA, is a recommended preoperative diagnostic tool for patients with thyroid nodules. However, patients with symptomatic or toxic nodules, or those with highly suspicious ultrasound characteristics, may choose to proceed with surgery regardless of the FNA result. Our study's aim was to assess the value of FNA in these specific patients with nodules between 1 and 3.9 centimeters, as we hypothesized that FNA may not affect the treatment plan in most cases. We conducted a retrospective review of patients with dominant solid thyroid nodules between 1 and 3.9 centimeters who were seen by a single surgeon over a 26-month period. We reviewed their charts to assess clinical decision-making, including the use of FNA and its impact on their management. We also collected and analyzed demographic, clinical, cytological, and pathological data. Patients with nodules larger than 3.9 centimeters or a history of prior thyroidectomy were excluded from the study. Of the 107 patients in our study with nodules between 1 and 3.9 centimeters, 83 or 77.6% underwent surgery due to symptoms, toxic nodules, or highly suspicious ultrasound findings. The most significant finding was that FNA or molecular testing only influenced the treatment decisions of 13 patients or 12.1%. For the high suspicion or symptomatic patients who went to surgery, FNA impacted management in just 8 cases, which is only 9.6% of that subgroup. This suggests that FNA had a limited influence on the decision to have surgery for these specific patients. In conclusion, for patients with symptomatic or highly suspicious thyroid nodules between 1 and 3.9 centimeters, FNA altered management in less than 10% of cases. Most of these patients chose to have surgery regardless of the cytology results. Our findings suggest that a thorough consideration of symptoms, ultrasound results, patient preference, and the surgeon's judgment can help determine the optimal management plan, potentially allowing patients to avoid FNA. Thank you so much for your time, and we'd be happy to answer any questions you may have during the in-person session.